Concepts of inflammation and immunity. Immunity is protection from illness or disease that's maintained by the body's physiologic defense mechanisms. There are two parts to our immune system. We have the innate immune system and the adaptive immune system. The innate immune system provides a nonspecific, quick action in response to an invading organism, and it consists of the skin, cornea, and mucous membranes. Our bodies have microorganisms that occur naturally throughout and are non-pathogenic as long as they remain where they are, but they help promote the effectiveness of immunity. The adaptive immune system responds to invading organisms by using a specific antigen to generate an immune response when exposed to an invader to the body. The body develops antibodies when exposed to a certain invader. When it is exposed again, the body recognizes that invader and it begins to protect the body. Our body has two types of immunity. Active immunity, which occurs when we're exposed to a disease, and our immune system, which produces antibodies to that disease. There's natural active immunity, where the body is infected with a disease and then responds with the illness and recovery. We have artificial active immunity, where antibodies are developed due to a vaccination with a weakened or killed version of the organism. Then we have passive immunity, which develops when people are given antibodies to a disease instead of producing them themselves. We have natural passive immunity, where the antibodies are obtained by a fetus through the placenta or the colostrum of a mother's milk. And then artificial passive immunity, where the body is injected with antibodies that have been created by someone else, another human or an animal. And we call this immune globulin. Immunity and inflammation work together to maintain health, prevent disease, and repair tissue damage. Inflammation and immunity are critical to maintaining health and preventing disease. Now, inflammation is a syndrome of normal tissue responses to cellular injury, allergy, or invasion by pathogens. It presents as light erythema, slight warmth, and slight edema, but don't confuse that with infectious symptoms. Immunity will be affected by diseases, injuries, and medical therapies. And despite the cause of the decreased immunity level, the client's health will be compromised. As long as the bacteria, viruses, molds, spores, pollens, protozoa, and cells from other people or animals do not enter the body, they're not going to pose a health threat. Immunity will stimulate processes that neutralize, eliminate, or destroy invading organisms, and most of them do not cause disease due to proper immunity. The immune system normally exerts actions only against non-self proteins and cells, and this means the immune system has to be able to distinguish its own cells and cells that don't belong. Non-self cells include infected body cells, cancer cells, cells from other people, and invading organisms. Self-tolerance is possible because of different proteins on the cell membranes. Some protein types are specific markers for human tissue and found only on human cells, with each person's cell proteins being specific only to that person. This would be the human leukocyte antigens, or HLAs. They determine the tissue type of a person, and they are a unique protein. Proteins, or HLAs, that do not belong to the body are called antigens. which are proteins that trigger an immune response. The immune system is influenced by many systems, such as the nervous system, the endocrine system, the GI system. Stem cells are immature, undifferentiated cells that are produced by the bone marrow. Leukocytes, also known as white blood cells, protect the body from effects of invasion by organisms through recognition of self versus non-self for initiation of those defense, inflammatory, and immunity actions for protection. Through destruction of foreign invaders, cellular debris, and unhealthy or abnormal cells. Through production of antibodies that are directed against invaders. Through complement activation forming membrane, which attaches complexes to enhance phagocytosis. Through maintenance of that self-tolerance. And through production of cytokines that stimulate increased formation of leukocytes in bone marrow and increase specific leukocyte activity. It is important to remember, though, that as the body ages, there is a decreased function of immunity that leads to a higher risk of infection and development of autoimmune diseases. General immunity is inflammation that is part of the general immunity. We have innate immunity, which is a native immunity or natural immunity, again, also called general immunity. Any natural protective feature of a person and is the first line of protection, and it does not provide true immunity. It does provide immediate protection against effects of tissue injury and foreign proteins, which is really critical to health and well-being. And it causes visible symptoms, that erythema, the edema, the warmth, and can rid the body of harmful organisms. Tissue damage may result, though, from an excessive response. With infection, this occurs in response to tissue injury and invasion of organisms. It usually triggers inflammation, but inflammation can occur without infection. When we have a joint sprain or myocardial infarction, for example. Non-infectious invasions, such as allergic reactions. Inflammation does not always mean that infection is present. Inflammation is that response that occurs to help provide immediate protection against the effects of tissue injury and those invading foreign proteins. If the inflammation responses are excessive, then tissue damage can result. It also helps initiate antibody-mediated and cell-mediated actions to activate full immunity. Protection by inflammation is immediate and short-term, but it does not provide true immunity. Inflammation is a nonspecific body defense to invasion or injury. And the degree of inflammation will be dependent on the intensity, severity, and duration of exposure to the invasion or injury. It can be very localized, or it can become systemic. Inflammation can occur without infection, and it does not always mean an infection is present. Infection is the invasion of pathogens into the body that multiplies and can cause disease or illness and usually triggers inflammation. There's several different cells that are involved in inflammation. This includes the neutrophils, also known as granulocytes. They attack the bacteria, destroying invaders through phagocytosis and enzymatic digestion. Macrophages They stimulate the inflammatory responses and antibody-mediated immunity. This includes phagocytosis. Basophils, they stimulate the inflammatory responses for general inflammation and those allergic reactions. Eosinophils, they act against parasites and prolong the inflammatory response. Mast cells maintain and prolong inflammation and allergic reactions. And then we have the complement system. This attaches to antigens, making immune cell attachment to antigens and phagocytosis more efficient. Phagocytosis is an inflammatory response that engulfs and destroys invaders. It rids the body of debris after tissue injury, with the neutrophils and macrophages being the most efficient. There are 5 cardinal manifestations of inflammation. We've already talked about the warmth, the erythema, and the edema, but there's also pain and decreased function. Stage 1 of the inflammatory response is vascular. We have a change in those blood vessels. The macrophage is the main cell at this stage. And with phase 1 of stage 1, we have constriction. With phase 2 of stage 1, we have hyperemia and edema. With stage 2, now we begin to see cellular exudate. Neutrophils are involved here. And then we see pus. All cell types except the macrophages are active in this stage, with the neutrophils being the most prominent. And then stage 3. This is where tissue repair and replacement occur. The white blood cells trigger new blood vessel growth, new blood vessel repair. We call this angiogenesis, and scar tissue formation. Adaptive immunity is specific, and it results in long-term resistance to the effects of invading microorganisms, also known as acquired immunity. The body must learn to generate specific immune responses when it's infected by or exposed to specific organisms. There's 2 types. We have antibody-mediated immunity and cell-mediated immunity. And these both provide long-lasting immunity. With antibody-mediated immunity, when the body is first exposed to a specific antigen, the body produces antibodies, which are proteins known as immunoglobulins, also known as gamma globulins, that bind to the specific antigens. The client is going to develop the illness with the first exposure, but on re-exposure to the specific antigen, the body produces large amounts of the antibody. And then that antibody begins to work to destroy the antigen, again providing long-lasting immunity. With acquiring antibody-mediated immunity, this is known as the innate native immunity or natural immunity, or natural active immunity, which occurs when an antigen enters the body naturally without human assistance. It is the most effective type of adaptive immunity. And then we have the artificial active immunity, which is the development of antibodies through vaccinations or immunizations. It lasts many years, but a booster may be required to retain that protection. And then passive immunity. Antibodies are transferred to a human after first being made in the body of another human or an animal. It does provide immediate short-term immunity, but then the natural passive immunity, we have where the mother passes that immunity to a newborn through the placenta or the colostrum of the breast milk. And finally, artificial passive immunity. Examples would include the tetanus vaccine, or the COVID-19 vaccine, or the rabies vaccine. Cell-mediated immunity is also called cellular immunity. This involves many white blood cell actions and interactions. Another type of adaptive acquired true long-lasting immunity. It does involve the T cells, which act by calling the white blood cells involved in inflammation. It helps regulate immunity by preventing hypersensitivity and immunity overreactions. It is effective against parasites such as viruses or protozoa and seek and destroy those non-self cells. Cytokines help control many inflammatory and immune responses. Protection that is provided by the cellular mediated immunity helps protect the body through the ability to differentiate the self from non-self. Its most easily recognized cells are cancer cells and cells infected by organisms that lived with the host cells, such as viruses. And it prevents development of cancer and metastasis after exposure to carcinogens. So, question. Immune function is most efficient when people are at which age? Infancy, teen years, 20 to 30 years, 50 years, and older. Immune function will be most efficient when people are in their 20s and 30s, and it does slowly decline with increasing age. The immune system is developing and changing during the infancy and teen years. So the correct answer is C. Another question. A 37-year-old man with polycystic kidney disease is on the kidney transplant list. He is to receive 2 units of leukocyte poor-packed red blood cells to treat a low hemoglobin. He asks the nurse why he needs this type of blood, and what is the nurse's best response? Is it causes fewer blood reactions for pre-transplant patients? It is less likely to cause hemolysis or destruction of the blood cells after transfusion? Is it all pre-transplant patients receive leukocyte-poor blood because it's absorbed better by the body? Or is it will decrease the risk of obtaining white blood cells from the donor that could make it harm your transplanted kidney? The correct answer is D. That human leukocyte antigen, that HLA, they're found on the surface of all body cells, and they serve as a cellular fingerprint. It recognizes self and non-self cells. So when those HLAs of the immune system encounter a cell that's foreign, the immune system cell will then take action to neutralize, destroy, or eliminate this foreign invader. So transfusion of blood that contains leukocytes increases the number of HLAs that are introduced to the body, and evidence shows that leukocytes that are present in cellular blood products are the main component involved in the occurrence of HLA immunization. And several studies show that leukocyte-poor blood products are less able to induce it. HLA immunization through blood transfusion will make it harder to find an acceptable kidney transplant match for the patient. For example, HLA match for the kidney transplant. In question. The nurse suspects that inflammation has progressed to the cellular level based on which client assessment finding? Warmth, redness, pus, or swelling? The correct answer is C. Responses at the tissue level cause those 5 cardinal symptoms of inflammation, which is the warmth, redness, swelling, pain, and decreased function. Stage 2 would be that cellular exudate part of the response. And that's the stage where the neutrophils are going to help in the formation of that pus. It contains that dead white blood cells, necrotic tissue, and fluids that have escaped from those damaged cells. It's the only one that's different in this situation.